I'm Dr. Mikki again with Medrine Health and Aesthetics. This is a continuation of the fillers of the forehead and temples we just finished. And now we're going into the cheek, which is a very common area for fillers. Most of the med spas, all they do day long, every day, is cheek fillers. I feel sometimes cheek fillers are overdone. I don't think they need to be overdone because it gives you a very plastic looking face. Is how people define they don't like it. That's very easily you get that with the cheek fillers. So don't overdo your cheek fillers. Sometimes you don't need it. You want to do fillers, or you want to use fillers more to contour your face. Okay, so if you don't need any contouring there, don't do it. If you need it, do very subtle, go little by little, and instead of just getting a lot of it put in there. Okay, so when we're doing cheek filler, we put directly on the zygomatic bone and do it like you're contouring your face. Okay, so once the cheek fillers are done, what kind of fillers do I like to use on cheek? I like to use the hard filler, such as the Lift by Restylane, or I like to even use Contour by Restylane, or I like to use the RHA4 by Rediscover fillers. So these are my favorite go-to for cheek fillers because they have a good consistency and they give a good hold. I like the Contour better because, and then RHA4 because it gives a very natural movement when you're smiling. Some fillers could give, a different look and feel when your facial movements, facial muscles are moving. Okay? And once we're done with the cheek, the next thing we're going to go is jawline, pre-jowls, and chin. That's my favorite procedure. A lot of times when clients walk in, they don't even know that that's what they need. And when we talk about it, when we do it, they're like absolutely gratified, satisfied. They're like, oh my gosh, how come we've never been told that that's what we needed? Okay, so again, you want to really go in for a good consultation where your provider can identify where the filler needs to go in to get the best contouring of your face. Okay, so jawline, I like to use again Lift, like a little stronger high G prime fillers, such as Restylane Lift or Restylane Contour or RHA4. Those are harder fillers. I like to use also cannula technique, which is more safer, less side effects like bruising or the other complications that we talked about, skin necrosis or blindness, because cannulas are blunt needles. They're not going to damage your tissue, nor it's going to penetrate into your blood vessel, so lesser